Hello everyone, welcome. It's nice to see everyone here on not really a cold January morning actually, so welcome. And hello to all our online attendees as well. We've got about 25 online at the minute too. So I will be talking you through a little bit of detail about our Talking Point Tuesday events in a minute, but before I do, I'm going to hand you over to Teresa Fortune, who is our Chief Operating Officer of the NIHR Innovation Observatory, just to give you a bit of an overview about what we do and how we can help industry. So welcome, Teresa.
Morning, everybody. Thank you for joining us today. I'm a bit of a last-minute stand-in, so normally this spot is held by our industry lead, Dawn Musgrave, but she's unable to join us today, so I'm just going to do a bit of a whistle-stop tour of the Innovation Observatory and why it is that we're reaching out to industry in this way. So the Innovation Observatory is funded by the National Institute of Health and Care Research, and we're hosted by Newcastle University, and we have been here since 2017. And we have a national remit to supply intelligence in health and care to key stakeholders in that space, in the health and life science space. So we are providing information to the likes of NHS England, Department of Health and Social Care, and NICE to help them with their policy development and their decision making. So as you can imagine, that's an awful lot of information that we gather and turn into intelligence. What we have there then is a huge resource, and we feel, it's important that we share that resource. So one of the things that we do, we have made huge efforts led by Jen in the last few months, is that we have developed our website so that it is an accessible resource where you can access our reports, our papers and our dashboards of the intelligence that we're gathering. Key thing about what it is that we do, or one of the things that we've done over the last few years, is we've assembled this amazing team, because to gather the information that we want, so we're looking at health through the health horizons, we're looking at emerging horizons, so technologies that are so new they don't really have a name yet. So how do you find something if you don't know what it's called? We're looking at those transitional technologies, so if that's something that's in very early stage clinical trial, as it passes through those clinical trials. And then we're looking at things that are imminent, so something that's actually been approved or it's in real-world evaluation stage. And that kind of information obviously is of huge importance to our key stakeholders, but also it's obviously of a lot of interest to the wider community also. So in amongst our team, we have developed the methods to gather this information and also tools to gather this information. And point of these events like Talking Point Tuesday, is to share how we go about things and to make it accessible, to show a community like yours of SMEs how you could use our approaches to interpret that intelligence for your own benefit. And one of the ways that we're disseminating that information is through a series of events, of which this is one. So with that, I'm going to hand over to Jen, who's going to take us through quite how Talking Point Tuesdays work and what we've got coming up next over the next few months. Thanks very much.
Thank you, Teresa. Right, so obviously I think some of you have already been to our Talking Point Tuesday events. This is sort of what we have planned for this year. So obviously today we're looking at State of the Nation, casting our eye back on the health and life science sector in 2024, and having a look forward into 2025 and what the future holds for that. So we've got 3 amazing speakers that will be joining us soon online. But looking forward, if you just cast your eyes over some of those titles, some might jump out. I will be sending out details of how to sign up to all of these events after in a follow-up email, and sharing the slides and a recording of this session. So please do sign up to those. We'd love to see you there. This is just sort of like a typical format of how we do them. If you've been before, you'll be familiar with this. We start off with an hour of networking, followed by a welcome, and then usually 3 speakers on the topic that we're looking at that month. And then we go into an expert panel, where you have your chance to ask questions to them about anything you like. And then at the end, we have a bit more networking and some virtual slots with our experts in virtual residence. Just to note, today we are actually full. It's been our speakers have been in demand this month, so we've got all those slots full. But we have these sessions every month, so do feel free to sign up. And again, I'll share those details afterwards. Kind of just tapping into what Teresa said before was the industry resources, which are all easily available on our website. Again, if you look at the resources page, you've got access to all of our reports, dashboards, technology briefings. That's just like a little example of how you can access them. And we've been told that the search function is extremely easy to use. So, if you're looking for anything very specific, you can type in the keywords and whatever we've done about that will appear there, so you can access that. Right, I think we'll move on to our first speaker now. So I'd like to welcome Jeff Davison, who's CEO of BioNow, to do his first talk. So welcome, Jeff. And also, would you like to share your screen, please, Jeff, so we can see your slides?
Yeah, okay, I'll try that now. Hi everyone, morning. I need to work out to share. I'm here.
Great. Thanks, Jeff. Over to you.
Okay, thank you. Well, hi everyone. Morning, and it sounds like you've started already in Newcastle this morning. So sorry I couldn't be there, but glad to be able to come and do this presentation, which I was given the title for, which was Sector Headlines for 2024 and Future Foresights for 2025, which is a very big title, and hopefully we've done it justice. I've tried to do this from a sort of global and national sort of viewpoint, and also then tried to focus in a bit more, give it a bit more of a regional northern focus. So hopefully I've done that, and hopefully that sort of gives you a bit of a view of the state of the nation, although it sort of surprised me when it was mentioned though that it's actually it's already still just early in 2025. It's been such a busy start to the year. Okay, so first of all, BioNow, who are we, what are we, and why do we do what we do? So we're a membership organisation. We focus on the north. I run that organisation with a small team that's sort of shown on the slide, and local to you in our organisation are Dave Holmes, who thinks online and lives near Newcastle, as does Owen Walsh as well. So they're both membership managers in our team. What do we do? And as I said, we're a membership organisation for life science business. We have about 330 members. They're spread right across the UK, but with a real concentration in the north. They span from large corporate entities such as AZ, who's our corporate patron, and a wide range of medium and smaller size members, and very small spin outs coming out from all of our universities, and we sort of proudly have 19 of those currently within our membership. Mainly across the north and into southern Scotland, so with Edinburgh University and some of the university sponsors shown across the bottom. We've got direct links and regular interaction with way more than 1,000 businesses across the north in the life science space, and contact with several thousand across the UK. We interact with those businesses, particularly through our events calendar, which I'll talk about shortly, and deliver events to more than 2,500 delegates each year. So we've got quite significant regional and national linkages, and so hopefully can answer the question that I was posed, which is what's been happening and what's going to happen. Why do we do this? Because in particularly focused on the north. Well, that's because there is around 1,500 life science businesses in the north, and they employ a lot of people. They represent between 20 and 25% of the UK life science sector, depending on which way it's measured, whether that's company number or employee, etc. Make a massive contribution to the UK economy. high value products being made, and a large proportion of them, more than 40%, made in the north, where a vast proportion of our pharmaceutical exports from the UK come from. And also, again, a very strong university sector, which is detailed there, and health sciences an important employer across the north. Okay, so this is the how, and one of the things we do is we help businesses make savings. We've got a range of preferred partners, which are sort of down the right of your slide there. And one of the things we do with one of our partners is offer lab consumable savings. And in 2023, the people, members on our sort of savings scheme saved over £700,000. Based on about an average 40% saving on what they make. So that's money in the on the bottom line, not taken out, not going out, so going towards further development of companies. And a top saver made over £100,000 worth of savings in a year. We also have sort of providers in tax credits, business insurance, and also grant applications as well. So aimed at trying to make the money that businesses do have go further. And I mentioned our events program, and we're all about bringing people together in useful ways. And events and topics are listed on here. They cover some of the key sort of areas I'm going to talk about later, but also there are some sort of gender-free sort of networking opportunities, like the Empowering Women in Biotech, our business pitching, etc., which are about just bringing people together in a way that makes it useful for them. Okay, so moving on to sector headlines in 2024 as we saw them. So, as I said, I'll focus globally and then try and get it a bit more locally. It's our perspective on this. It's not all encompassing. It's not exhaustive, and so I may have missed areas, but let's get going and see what you think at the end. So. Some key areas that were hot in 2024. Anti-aging research was considered as moving forward quite significantly during 2024. Key strength in Newcastle, I know, and so really important to sort of have these areas sort of represented across the north. GLP-1s, which were the so-called weight loss drugs, are now moved as if maybe a major growth driver, but maybe the major growth driver for the biopharma industry. So large amounts of sort of income generated from those drugs, increasingly from a wide range of companies. Gene editing legislation delays in the UK were a key sort of thing for us, and potentially could potentially sort of slow the UK's sort of leading position in that. Hopefully that will be reviewed going forward. A number of very significant pharma partnering deals during 2024, where pharma were acquiring technologies from biotechs that they sort of areas they wanted to move into. And after a really slow start in 2024, ended up being about the third best year for biotech financings, and that was after 2020 and 2021, which were really sort of significant years for the sector. But there's still a number of cautions around sort of that year. So the IPO market was still closed, certainly in the UK. Some UK companies looking to the US to list, but still pretty static market. Fewer companies raised money and are raising money. Some big deals were sort of skewing those figures, I think, and also the US mopped up a massive amount of the VC availability. So around 3/4 of VC funding went into the UK and into the US in the sector, with the EU only taking a small stake, and the UK taking a good stake of the EU sort of cut, but and still the strongest in the EU, but still a relatively small amount on the global stage. Okay, some more notable developments now. So we did complete both the UK and US cycles, electoral cycles, and I think everyone will be aware of that, especially today. We'd hope that would increase stability and confidence, and I think we started to see that in the UK. great to see the UK rejoining Horizon Europe. The budget is big and really good for the research base and supporting that sort of area. We had the budget, the Labour government's first budget, which had sort of commitments to the life science sector, which was great, and that included a further funding for Our Future Health, which reached 1 million participants in 2024. UK Life Science Innovative Manufacturing Fund was refreshed with up to £520 million for businesses with capital investments in that space, mainly larger businesses, but very positive. The Northern Powerhouse Investment Fund too, covering all of the north, including all of the northeast this time. So really positive step forward there, and important sort of fund for the sector. And further progress on the devolution across northern regions, and those regions start to in some areas starting to get some traction and being used to focus on the sector. A fair range of member challenges during 2024. It's been a massively tough environment to raise money. Investors are very cautious, and certainly for new investments, and even for existing portfolio sort of support. That I think that's been challenging, but new funding has been hard. That's flowed down into the sort of specialist suppliers, so the contract development, manufacturing, and clinical contract research sort of sectors, and other specialist suppliers have been really challenged by the lack of flow down of funding from sort of those biotechs and med techs that are raising money, and possibly the cause of sort of output being reduced in the drug discovery and development and areas. We've got a national insurance increase looming. That's coming in April. That was announced in the budget. That's going to impact on companies that, I guess, probably over about 10 employees. I appreciate that's multi-sector, but I think it is a challenge, and it will impact on growth. And I think at sort of anything above 10, you're looking at a wage bill increasing quite significantly, and reducing the number of new hires that businesses will make. Talent shortages, well known, the challenges around that and the sort of areas we've got shortages, but Brexit effects still being felt there, and the immigration challenges are significant, and then a wide range of regulatory challenges which are heavily impacting, particularly on the SME sector, which is doesn't have the capacity necessarily to sort of navigate all of these challenges. But hopefully some green shoots toward at the end of as it was a decent year in terms of biotech financings. We sort of started to see an increase in sort of scale of financings towards certainly in the second half of the year across our membership network, and there's a number listed here, and so hopefully some sort of positivity and green shoots there to look forward to into 2025. So moving on to 2025. Now looking at the sector forecast, as the title or the subtitle suggests there, I guess we're hoping that there's calmer waters ahead in 2025. The sort of interest rates are sort of static or maybe slightly lower. Inflation coming under control, but as I said, the sort of UK NI increases there, and we've got a low growth environment right now. There seems to be less volatility across the board, but and the UK government is starting to sort of announce initiatives and an industrial strategy due in the spring, where life sciences will feature. So hopefully things will flow further from there and continue to calm things down over on this side of the water. However, as we know, Trump came into power yesterday, and we've yet to see what impact that will have on, well, pretty much everything, but certainly in life sciences. Tariffs may come into play that have been promised. What the UK-US relationship will look like is unknown. There's been some talk about the Biosecurity Act maybe helping UK life sciences. Again, I think I've got a double question mark there, so I think that's yet to be seen. So whole range of challenges over on the US side and changes which may not add to the calming of the waters. But on a positive note, greater alignment between the UK and the EU in the regulatory area as part of the government's European reset, I think is a positive thing, and hopefully that'll continue to start to give some sort of certainty to businesses that are in those areas. And then some sort of technological sort of areas that we see and have a key potential impact on the sector. Again, these are not all inclusive, and so I may have missed some, but AI across the board is sort of having a potential impact everywhere, particularly feeding into drug discovery and sort of diagnostics, and actually the whole of healthcare really, and how it might impact on delivery of healthcare. Just note our first Buy Now AI Summit on the 20th of May there, where we're going to try and unpack some of that for the sector. Continued drive towards personalised and precision medicines. There's a whole range of approaches listed there, but from gene editing through to omniomics and everything in between, real key areas that we'll sort of consider, and our businesses are sort of working towards a lot of opportunities and challenges there. And the continuation of drug repurposing has been a big sort of driver in the pharma industry over the recent years, and will continue to be so. So the use, for example, of statins in reducing dementia risk, or the GLP-1s being used in other areas beyond weight loss. And further hotspots for us are, the 3D printing and of everything from medicines through to devices will continue to sort of become a key driver impacting healthcare. Nanomedicines in the delivery and safety and sort of targeting of medicines. Digital imaging and the use of AI in that as well, coming in to sort of improve throughput, solve skills challenges, and improve accuracy and possibly even earlier diagnosis of through those routes. And a lot of talk about technology saving the NHS, which it's not a phrase that I really like, but the use of technology to sort of improve patient care, increase throughput and efficiency, and being used for things like remote monitoring, virtual appointments, etc., etc. And so finally, sort of coming back to the northern region and future foresights and what's happening more regionally, there's a whole range of investment zones, free ports, mayors and combined authorities that have a sort of life science focus, and I think it's great to see that pretty much all the north is covered in those sort of 3 bullet points, and everything from the Liverpool City region right across to the northeast, and pretty much everything in between. And really good initiatives like the Great North and the mayors coming together to sort of join up and work on a pan-northern basis to make devolution work and hopefully reduce any sort of fragmentation that exists or might exist. And PIF2 having the sort of life science focus is really important to us, and a really important fund for the north alongside Northern Gritstone, which is only for some of the universities, but important to see northern funds, and have as with a beacon really, and shining a light on the strengths up here in the north. The Medicines Manufacturing Innovation Fund will be an important sort of fund for some of our businesses, certainly those in manufacturing. And with the industrial strategy yet to come, and hopefully continue this sort of investment in the sector and support of the sector, then I think we're looking quite positively towards 2025 with the hope that those green shoots that I mentioned at the end of 2024 can really start to flourish and grow. So fingers crossed that's the case. So that's me. Thanks for that. I'm happy to answer any questions. I don't know if that's now or at the end. But they're my contact details. If anyone has any questions, then please feel free to contact me.
Oh, brilliant. Thank you, Jeff. That was fantastic and like so much information there, but it looks really positive for the sector ahead. And as usual, AI is at the forefront. So thank you. I think what we'll do is we'll go straight into our second two speakers and then we'll have some questions at the end if you can hang around for that. Is that okay,
Yeah.
Jeff?
Yeah.
Brilliant. Thank you. Right, so our next speaker is Laurie Smith, Head of Foresight Delivery at Nesta. So welcome, Laurie.
Hello. I'm just going to share my screen, so give me a moment. Has that worked? Doesn't seem to be coming up on your screen. Oh, you got it. Brilliant. So, yeah, I'm Laurie Smith. I'm Head of Foresight Research at Nesta. Thanks very much for having me. I'm sorry I couldn't be there in person. So the last time I spoke at the NIHR Innovation Observatory event, I realised I'd given myself a really long and perhaps even boring sounding title. I think my title was something like Interesting Methodological Directions for Horizon Scanning and What That Might Mean for Health. And that's a bit of a mouthful. So the title of this one, State of the Nation 2024 Summary and 2025 Predictions, sounds a little bit more intriguing. And all for this, all the credit should go to the organisers. And maybe they give me that title because they didn't trust my one last time. Anyway, hopefully I can deliver something that's worthy of the rhetoric. So what am I going to talk about? Well, I'll start with an introduction to my employer, Nesta, and the team I work in, Discovery, so you can sort of understand where I'm coming from. And then I'm going to talk about 4 of our recent products and try to pull out what they mean for the state of the nation in 2024 and 2025. So they're innovation sweet spots, some work we've done with our mission studio, methodological innovation, and some work we've done with methodological innovation and signals. To provide a bit of context, I'm going to need to explain the nature of some of these products, which means I might cover similar ground to the last talk I did at the observatory, but I hope you'll forgive me for that. I'm working on the assumption the focus of this event is on health because we cover environmental issues and early years issues as well. And I should say we're a small team working for a medium-sized organisation focused on specific topics. So inevitably we'll miss interesting ideas, and there's lots of interesting ones I saw in Jeff's talk. So I ask your forgiveness for that in advance. And the data we've looked at so far is UK-wide data rather than data for the Northeast specifically. We are moving our methodologies to be able to look in the regions, but we're not quite there yet. So, Nesta and Discovery. So, what's this myself? As I said, that's my sort of name and job title. I suppose my career I focused on sort of innovation, foresight, and emerging technologies, largely in the UK national academies, things like the Royal Society, Academy of Medical Sciences. I've got interdisciplinary backgrounds, so half natural sciences, things like biochemistry, physiology, statistics, half social sciences, things like sort of ethics, anthropology, history, that sort of thing. I work for Nesta, which is a charity. It's also an innovation agency, and we design, test, and scale new solutions to society's biggest problems. And we've got 3 missions. First is to promote a fairer start to help solve inequalities, particularly in young children. Secondly, we help people live healthier lives, particularly focused on obesity. And finally, we help the UK have a more sustainable future, particularly focusing on reducing emissions from household heating. I work in the Discovery Hub at Nesta, and we like to think of ourselves, perhaps a little bit pretentiously, as Nesta's test kitchen. So we try out ideas, and some of those make their way to the main kitchen. That's Nesta's programs work, and some of them don't, and we learn some interesting lessons from that we feed into the organisation. And here's the Discovery team. There's about 10 of us. Got a whole wide range of different skills. So people who work in foresight, emerging technologies, programs, comms, design. And we've also got sort of an extended sort of network within the organisation. So data engineers, we've got residents I'll talk about in a moment. And the overwhelming majority I'm going to talk about in this session comes from them rather than me. So they deserve all of the credit, or most of the credit at least. So the first product I want to talk about is something called Innovation Sweet Spots. And what we do is we harness large data sets to identify promising innovations that are on a growth trajectory. And we look at the convergence of research, business investment, and public interest as proxy for future sweet spots. So innovations are going to make a large impact. And we try to spot trends, new opportunities, and also stagnation as well in various societal challenge domains. And we've done different iterations of this. So we've done one on early years, one on food tech, and one on green tech. So they reflect our missions. Initially, I'm going to focus on the early years edition of Innovation Sweet Spots. That's the most recent one we do, and there's a few health messages there. What we're trying to do with this as a reminder is create a multi-dimensional picture of innovation. So we use multiple data sets, so NIHR IO research funding, patent data, academic publications, and Crunchbase investment data. And we sort of use that data, and we then think, well, let's say we want to look at early years. We use a combination of machine learning, manual labeling, and large language models to label that data. And from that, we've got about 110,000 data points. And so to our knowledge, is the first time anyone's created such a multi-dimensional picture of innovation in early years. We then create a framework based on conversations with experts, the academic literature, and particularly the UK's government's development matters guidelines. And that allows us to get that data and divide it into different categories, so in different technology domains and different application domains as well, so we can sort of understand that. We then analyse how the innovations perform across the system. I'm going to show an example of that in a moment. And then we show a picture of innovation. We've got a matrix showing the growth of innovations versus their magnitude. And we divide that into 4 different categories. So stuff can be hot, where they've got high magnitude and high growth, or stuff can be dormant, where it's got low magnitude and low growth, and everything in between. And that allows us to build an overview of the innovation system, indicating the status of multiple innovations across each data set. And finally, we engage with experts about, well, what does that actually mean? So we did one on early years, and here's some of the sort of data from that. And you can see that digital technologies and AI in particularly prominent. And really interestingly, perhaps for this audience, is that health applications for early years innovations seem particularly prominent. So across 3 of our data sets, that's the biggest category. Now, those ones are quite upstream. That might say something about the sort of future of innovation in this sector. So in earlier iterations of this, we've done it on food tech, and we've combined it with foresight methods like futures wheels and Delphi and interviews. And we've also chucked in NIHR research data as well. So some findings from this are that personalised nutrition, there's lots of interest in that's gone up by 550%, in investments gone up between 2017 and 2021. But the foresight work show that actually the benefits of that might not be very evenly shared across the population. Again, in alternative proteins, we can see that venture capital funding has gone up by 800% from 2017 to 2021. And that's actually very driven by sustainability and animal welfare concerns. There's much less interest in health, which maybe is a challenge for the sort of health sector, because people involved in food seem less interested in health than maybe Nesta would want them to be. We've also done some Delphi ranking as well. So we asked a bunch of experts what likelihood they think different technologies would they benefit obesity, which is our interest, or would they decrease obesity? And we can see that reformulation scored highly, as did meal kits, weight loss injections, and personalised nutrition. Maybe alternative proteins, the impact of that's a little bit less clear. And things like dark kitchens, kitchen automation, and food deliveries ranked much lower. This was done before the boom in sort of GLP-1 inhibitors, so maybe they underestimated the impact of weight loss injections. And I should say it's a small pilot, so we only involved 8 experts who did 375 pairwise votes. And what talk on sort of innovation could you have without talking about sort of obesity drugs? And we know that, as Jeff said, they can have a real impact on people's health and can substantially reduce obesity. It also is looking increasingly likely they can tackle other conditions like heart disease and maybe even things like drug addiction and Alzheimer's. However, they're also not a magic bullet. We know the drugs have side effects, as lots of drugs do, and people often start putting on weight afterwards after they finish taking them. And Nesta, some colleagues of mine, not my team, but another team, had a bit of a look at the economics of these drugs. And they don't come that cheap at the moment. And there are lots of people who experience obesity. And our estimate, based on a whole bunch of assumptions, the research is on Nesta's website, that it might cost £115 billion to halve obesity using these drugs by 2030. Of course, the price of the drugs are likely to fall as some of them come off patent, and there'll be new variants that'll hopefully be cheaper, easier to administer, so that sort of improve them. But we sort of think maybe in the short and medium term, these alone won't solve obesity. Perhaps they need to be used in combination with preventative measures and maybe also behavioural measures as well. So when people maybe sort of come off them. So that's some sort of look at obesity drugs. So I suppose these are sort of the insights for 2025. So we're seeing that on this sort of research, so health may become a prominent application of early years digital technologies, food innovation technologies, often sort of focused on sustainability and commercial success rather than health. We've seen some big growth in personalised nutrition and also alternative proteins. GLP-1s can make a big impact, but it might be tricky for them to solve obesity at a mass population scale in the short to medium term. So let's look at some other work we've been doing with our mission studio. So Nesta has something called a mission studio, where what we do is actually create commercially viable companies that have social impact. And this is distinct from the more established impact investing, which Nesta's done for some years, where folks invest in existing companies that have social impact. And there are examples of mission studios in Germany, in America, and in the Middle East. And when creating a new business, our mission studio team undertakes a sprint to work out what's the best sort of focus and business model. And the current sprint focuses on our Healthy Lives mission. So Discovery did a bit of work, so that's the team I work in, with the Mission Studio team to understand the state of the art of innovation using data from our horizon scanning work. This is an internal exercise, so the work I'm going to show here isn't as polished as the work I showed previously, so it comes with a bit of a health warning. However, the data is also hot off the press. It's more up to date than the earlier stuff. We're also at the start of the sprint, so we're looking very broad brush. We've got some very big categories, and the data we've got comes from Crunchbase. So one area we looked at was, I suppose, the economic theme. Here we've got data on food processing. So from 2014, we can see a wave of investment in food processing innovation followed by a steep decline. And this is true across multiple metrics. So the size of deals, the number of deals, and the types of deals. Time is short, so I can't share all of our sort of images, but a similar pattern can be seen out of home sort of food, so things like sort of restaurants, and also in sort of food retail as well. In fact, the decline is probably steeper in out of home than other sub-themes, possibly reflecting sort of changes post-pandemic. If you look at health in sort of the area of sort of diabetes, we don't have as clear a trend here as the economic today. There seems to be quite a lot of fluctuation. Maybe if you squint a bit, you can see a slight uptick in pre-seed activity and seed investment post-pandemic, but I don't know, that's pushing things a bit. Around health and nutrition, we can see a similar pattern to the economic theme. So a big rise in investment and a big decline. And some of that I think might resonate with what Jeff was talking about sort of previously about sort of wider financial environment. So here again, some of our insights. So we see a wave of investment in retail, food, and out of home in the food sector, followed by a steep decline, particularly in the out of home area. Diabetes, a bit hard to see a pattern. Nutrition, similar patterns to the economic theme. And we also looked at agriculture and agri-tech as well. That was a bit more resilient and less steep decline. So now we move into some methodological innovation. And what Nesta does is we've got residents. We've got a residency scheme. We bring in experts from industry, academia, the public sector, who are leaders in their fields, who support knowledge transfer into Nesta and the wider organisation. And they help us build thinking for the future. They foster continuous learning and build new networks and profile. And they bring practitioner industry expertise, specialist networks, methodological expertise, and skills from entirely different disciplines and different fields. And how the scheme works, it's a part-time engagement, about 20 hours a week, runs for 3 to 5 months. The residents will be contracted to deliver a specific project. And we usually have about 4 residents, and you can meet some of our residents here. So these are some of the ones who are with us at the moment, who have just recently been with us. And they've sort of got some insights. Obviously, they've got sort of deep theoretical knowledge. First is we sort of, one of them's helped us learn about theory-based evaluation, and that can be useful in understanding the impact of complex health interventions in complex systems such as health. So where things like randomized controls are a bit difficult, and it's like you're trying to sort of work out the strands of causality. Second, we're doing some really interesting work around simulating the impact of policy interventions. So creating a model, sort of computer model of different policy levers based on evidence, so things like the Campbell collaborations evidence and Cochrane collaboration, and working out, well, if you pull certain levers, what difference can policymakers make? The sort of third thing is around, I suppose, is what I said about anti-obesity drugs, and it's also stressing these drugs are powerful and really useful tool, but also want to stress the importance of the wider food environment. So we had a resident who's doing some work on planning and the food environment. And something that sort of came a little bit unexpectedly is perhaps because you get sort of all sorts of knowledge transfer is, I suppose there's going to be sort of drops in barrier to entry for software development. And for health, because of AI, and for health, that can see some really interesting things like a wave of bespoke, rapidly developed health apps, developed much more quickly than ever before. And the final area I was going to talk about is our signals, which is our annual collection of articles concerning trends and data points and ideas that give some indication about the future. And so what is a signal? Well, they take different forms. There can be sometimes they're sort of counterintuitive ideas. So we've had signals about abundant but intermittent renewable energy. Sometimes they're sort of big ideas. Sleep being a new frontier of health or health inequality. Or there can be things like a canary in the coal mine. So we did one about the blowback against climate activism, which actually we're seeing at the moment. Remember, Nesta cover a wide array of different topics, not just health. To make a good signal, you need something that's evocative, that appeals to non-experts, that's timely and relevant, simple, clear and concise. We like to consider the consequences to marginalised and vulnerable groups, and we wanted to say something interesting about the world. And here's a sort of gallery of our signals for this year. It's all on the Nesta website. They cover a range of domains, from agriculture to science and technology studies. Some are more near-term, like AI-driven parenting apps. Some are longer term, like harnessing water on the moon. Some are mission aligned, or aligned to our missions, like energy islands. Some less so, like, say, talking with plants. And to talk about them, I'm going to see if this works. I'm going to see if I can get a video from my colleague to work. And she's going to talk about the signal we did on public diners. Let's see if this works.
Hi, my name's Sarah and I work in the Discovery Hub at Nesta.
I'm just going to stop a second. And Jeff, because I can see you online, can you hear it? Lovely. Thank you.
And this year I've been researching a really interesting signal. This year, a food charity called Nourish Scotland has advocated for the revival of publicly funded canteens so that people can have easier, cheaper access to really healthy food. This is something that's happened actually in the past in the UK. There was an initiative in the 40s and 50s called British Restaurants, where people displaced by World War II bombing could go and get a cheap, nutritious meal. And we're asking, what are the options for government delivering something like this today, thinking about the fact that 2/3 of meals purchased out of home, we know, are above calorie intake recommended levels. So this is a really interesting idea and we're excited to see where it might go.
Thank you, Sarah. So I'm going to the next slide. Oh, it's not now. Maybe I have to run it to the end to get to the next slide. There we go. Yeah. Of course, there are downsides to this as well, because there's already a sort of flourishing food environment, and we don't want to impose on that. And Nesta isn't advocating for these signals; we're observing them and sort of describing them. So I can't seem to get to my next slide, which is frustrating. So I'll carry on regardless. We've got a lot of broadcast coverage for this. So 20 pieces of broadcast coverage from Belfast to Jersey. We've got a first time on Heart Radio Breakfast. So we've got to speak to Amanda Holden. Got a return to the Times Radio on the sort of Friday evening. And actually we got offered a slot, or a regular slot, on BBC Radio Midlands. Sadly, we didn't get a similar offer from a station in the north. So what are the insights from this? I'm afraid I can't move my sort of slides on. First, we might see some innovation around the public diners idea, where governments might subsidise affordable, healthy and sustainable food. That's a possibility. Another one is we're seeing a rise of humanoid robots and autonomous AI agents which means we might need to give some thought as to how we interact with AI and robots, including in the world of healthcare. We're seeing a rise of parenting chatbots, but we also need to make sure that people who might be economically disadvantaged can access them. And also we're seeing a play renaissance, because there are government plans for a commission on play that could improve children's mental and physical health. So thank you very much for your time, and I'll stop there. And I think, have I stopped sharing? No. There you go.
Oh, that was amazing. Thank you very much, Laurie. That has given us a lot to think about. And we wouldn't have minded if you'd created your own title. So if you're all right to hang on as well until Helen has spoken for some questions, that would be great. Right, okay. So our final speaker for today is Helen Oldham, who is co-founder of Lifted Ventures. So welcome, Helen.
Hi, yeah, so pleased to be here today. I think I have to do some in-residence calls at 11, don't I? So I think the likelihood of me being able to stay on, take questions is small.
That's all right, Helen. It's not actually until 11:30 onwards,
right.
the calls. So yeah, if you can, that would be great to hang around. Thank you.
Great.
I'll let you share your screen.
Yeah. So can everybody see that? Yep. Okay, so hi everybody. I think I'm going to be picking up on some of the themes that both Jeff and Laurie have talked about, but today I'm unashamedly going to take a look from a sort of gender perspective, and I'm going to talk about why that's important, not just because it's the right thing to do, but because there's some significant economic benefits to that. So I'm the co-founder of Lifted Ventures alongside Jordan Dark, and we want to move the conversation around from disparity and gaps. So we don't talk about the 2% of funding going to female founders. What we do talk about is that female founded businesses are going to generate probably twice as much revenue per pound invested, despite receiving half the capital. We know that they're more likely to exit. So we know that 12% of female founders will exit versus male or co-led teams at 8%. And we know that they're more likely to exit more quickly. So there are some strong business benefits to backing women. So just move that. Yeah. So we know that women-led businesses also achieve a better than average return. And whilst we're sort of based in the north of England and our heartlands here, we do think globally, and we support female founders to take that global journey. We're more than a talking shop. So whilst we do spend time in events like this talking about the opportunity of backing female founders, we're very much about generating results. We are an angel network and a co-investment organization, and I'm going to talk about how we do that in a second. So in our flywheel, you can see that at the heart of our network, we've got predominantly a women angels network of over 45 women who are investing. We've got connections into the VC community, and particularly into women in VC, because we know they'll advocate for our deals and help them to navigate the journey through to investment committee. We've produced a couple of blueprints, so we're very keen on supporting diverse female founders, and our blueprints to start with have looked at why ADHD female founders are becoming more prevalent and why they're highly backable because of things like their hyperfocus, their ability to build really strong diverse teams, and to generate exceptional results in short timescales. And then lastly, we have a big raft array of education programs on both the Women Angel side, where we know that we need to build capacity so that more women are investing in female founders, and also on the female founder education side. Here are our results. So yeah, this is just demonstrating that we're not just a talking shop. In 2024, which was our first full year, we hosted 22 events. We onboarded all of those new lovely angels. We completed 13 deals, helped to raise 5 million. We run 6 accelerator and education programs and launched 2 blueprints, all of which you can see on our website. So I've been asked to also do my version of the sort of horizon scanning piece. So I'm going to take some data points and share with you my perspective and the Bowhurst perspective on female founded deals and co-led teams. And I think to start with, I was keen to first of all point out that Henry Warwood and the team have kindly shared this data with me, which is really kind of them. And I asked them to look at a data set around life sciences. And for anybody who wants the detail around how they curated that, these are the sectors that they pulled data around. So biotechnology, medical devices, pharma, precision medicine, regenerative medicine, research tools and reagents, synthetic biology. So Henry also asked me to emphasize the fact that there's actually quite a big lag in terms of data from the most recent year, and we're still only in January. So the 2024 data set that I have is still being updated because deals are still being reported and therefore the data set's being updated. As a bit of context, I also wanted to share with you this important work. So we, as part of Lifted Ventures, are huge advocates of the fact that VCs should sign up to the Invest in Women Code, and which means that they have to share their data around the number of women that they see in their pipeline and how many of those get to the IC committee, the investment committee, and how many then are backed. And for context of the data that I'm going to show in a minute, you can see that last year's statistics, so 2024, which was reporting on the 2023 data, showed that in the VC signatories to the Invest in Women Code, in female-only teams, 9% of Invest in Women Code signatories backed female-only teams, 11% backed female-only teams. They were the most recent signatories, so there was a difference in behaviour between ones that had signed up recently and ones that had signed up previously, and that compares to the wider market at 8%. But where the starkest difference comes in is in mixed gender teams, where the Invest in Women signatories, 32% backed mixed gender teams. The most recent signatories, so these were the ones from 2024 and 2023, 42% backed mixed gender teams, and that compares to the wider market at 28%. And I'm going to explain why that's even more important when we come on to the next data sets. So here is the data for UK deals from 2018 to 2024. Again, as I said, that 2024 data is shifting week to week, but this is the latest statistics that we had. In line with the global market, and I think both Jeff and Laurie talked about the fact that there were lots of challenges in the market last year, you can see that the deal numbers declined in 2024. So global deals fell by 17%, but actually the UK life science market was pretty much in line with that, down 18%. I think where it does get interesting is where you see these stats here. The overall deals, as I've said, reduced by 18%. But the most interesting stat on here is the fact that actually mixed gender team that were backed stayed the same as in 2023. Whilst only female-led teams also reduced from 37 to 28. So I think there's some strong messaging here around the fact that co-led teams are being backed more frequently. And yeah, if you were looking for some tips, I would say you need a woman on your team because you're more likely to be backed, is what those statistics are saying to me. I've got some regional stats here, which I thought would be interesting for everybody here, particularly those of us who are based in the north, but I specifically concentrated on the northeast and given a little bit of extra data here. But you can see what I've done here is shown where in the vertical axis here, we've got all male teams, mixed gender teams, all female. And then in red if they've declined year on year, so this is 24 versus 23, in green if they've increased, and white if they've stayed the same. So I think there were some strong performances from the Northwest up here in terms of their gender perspective. So although the number of male-led teams receiving investment reduced, actually the mixed gender teams and all female teams increased. In Yorkshire, again, the same thing. Overall deal numbers reduced, but the number of mixed gender and female teams increased. And the same for the East Midlands, where all deals increased. And then lastly, just specifically for the Northeast, I've actually put last year's numbers in there as well. You can see that, yeah, the all male team numbers increased actually, mixed gender reduced slightly, and all female increased. So some really interesting stats there across the piece, which is really just breaking down the fact that in that mixed gender environment, actually there was some, it stayed the same across a declining market. So I'm going to whiz through these next slides, given that I've only got 3 minutes. So one of the areas that I wanted to pinpoint as particularly high growth in the early stage markets, so Lifted Ventures operates in early stage markets, that's pre-seed and seed, is that there's some strong interest coming through in women's health. And we know there's huge market potential there. Lots of stats showing that it could release millions, potentially billions, into the global economy if more of these women's health and femtech products were backed. I also picked up on some of the stats that we've been thinking about inside Lifted Ventures, and that is the Pioneer report saying that actually global hubs are coming out of Bristol, Edinburgh and Glasgow across the UK alongside London. And 3 investor segments that we're particularly interested in at the moment: pharma, research tools, and reagents. So I would add to the points that both, particularly Jeff made at the beginning, and some of the ones that Laurie made as well, is that some things have not changed. We know that price pressures continue. The US regulatory environment, particularly given the changing government there, is very unlikely to reduce. In fact, it's more likely to increase. And even the UK regulatory environment is also likely to get more challenging. We also know that the UK life sciences sector has been underperforming, and the BB stats talked about that in their report. However, the things that we are sort of using as a North Star for the way we're seeing the life science sector is that we know that the British Business Bank is forming the British Growth Partnership, and that's going to be backed by pension funds, so hopefully more capital coming into the markets. Northern Gritstone have still got a significant amount of their money to deploy, of their £312 million funds. We know that AI is being funded inside lots of NHS trusts, and in the opportunities that we've been seeing coming through Lifted Ventures, that's very much in evidence. Generally speaking, Deloitte is saying that their survey said that 75% of life science execs were optimistic about 2025, 68% anticipate revenue increases, and 57% predicting margin expansions in 2025. 60% of execs plan to increase their focus on generative AI across the value chain. And our perspective is that investors almost expect to see some of that in opportunities at the moment. There has to be a strong business case for not including that. We could debate whether that's right or wrong later. 32% of biopharma respondents said that they were considering investments in customer engagement and enabling technologies as a priority for 2025. And that speaks back to Jeff's point around supporting the patient engagement and experience process inside the NHS. That is very much a key theme coming through. And lastly, KPMG strongly predicting an increase in M&A and valuations this year, which is good to hear. I wanted to end on this quote from Christine Hockley, MD at British Patient Capital, who said that the 2025 life science investment outlook is much more positive. and particularly because we're expecting some exits in this year, which obviously there'll be a trickle-down effect for that into the other investment sectors. So I'm going to stop sharing now. That was a sort of whistle-stop tour through my gender lens on investment in the life science sector.
Helen, just think it's wonderful what you're doing, so keep it up. We think we're going to maybe go to our fireside chat now and then end with questions, if that's all right. So Stu, if we could just go back to the slides, that would be great. Right, I would like to welcome up to stage Pauline Addis and Kate Lanny, who are both research associates at the Innovation Observatory. They're here to talk about game-changing technologies. Welcome.
A very warm welcome is always appreciated.
Yeah.
Come on, let's go.
Stu? Yes. Right.
Hello.
Hello. I've got some questions to ask you guys. So first of all, would you just like to introduce yourselves and explain a little bit about your role at the Innovation Observatory?
Hi everyone, lovely to see you all, and hello to everybody online as well. My name is Pauline Addis, and I'm a research associate here at the Innovation Observatory, and I've been here for coming up to 2.5 years, which is really exciting. Part of the reason I really love my job is that we get involved in a whole range of different projects, and this is just one of the many things we've been doing. So I have a very active brain, so I love the fact that I have a huge variety in my job, which is great fun. So really looking forward to getting my teeth into game-changing tech. Kate.
Thanks. Yeah. So I have been here about a year, but I used to work here and then went for a role in industry, then came back because, like Pauline, I love sort of the research side of it. And I feel like when you work here, there's a lot of diverse projects, and it's lots of different horizon scans we've been working on.
Great. So do you want to both maybe talk a little bit about the game-changing technologies that you were focusing on individually?
Yes. So overall, this is a project to do with several different arms to it. So I've done a little bit of background digging. So in the 2023 UK Science and Technology Framework, there were 5 critical technologies mentioned, and of which 3 of these were AI, artificial intelligence, quantum technologies, and bioengineering, also known as engineering biology. So we're looking at these 3, and also more recently than that, having a look at wearable technology. So I'm leading the bioengineering arm, and at the moment leading the wearables arm, and in a couple of months one of my colleagues, Julia, who's in the audience, will be taking over because she's only just started. We thought we'd give her 5 more minutes to get her feet under the table. So the bioengineering one is basically to do with manipulating things on a nano scale. So having a think about, I mean, we all know of the mRNA vaccine, the COVID vaccine, that was one of the bioengineering ones. So really having a think about quite small scale tech and what that can do within the human body. And I can go on to give some examples once I've let Kate give an overview of AI. So this is, I think, a particularly interesting one, because as we face more and more challenges in healthcare, more and more challenges in diseases, we've got to think more and more carefully about how we're going to manage all of these and manage it effectively and efficiently. And so when I come on to give some examples of some really groundbreaking things, I'm really looking forward to seeing what we can do with that. But I'll let Kate chat about AI before I wish on too much.
Yeah, sure. So my team has been looking at the applications of AI in healthcare and trying to do a scan to identify all of those new technologies. And as you can imagine, it's like a huge area. So what we've decided to do is break this year-long scan down into 4 different reports, and each one we're going to focus on a different aspect of AI. So the one we're working on at the moment is generative AI. And we found lots of technologies from the kind of very early stages of development right up to ones that are kind of ready for clinical use.
Wow, that blows my mind. So I think, Pauline, you mentioned that you actually had some examples that you could share today. Do you want to have a chat about those?
Yeah, I'd love to. And what was really great is, and again, Helen, thank you very much for your talk just now, because I noticed on the Beauhurst life science data deal that you were talking about quite a few of these, the biotechnology. I took a screenshot, so forgive me from reading from that, but it was really interesting that a lot of the things you were mentioning were the things that were coming up for us as well. And number one on the list was biotechnology. So a couple of the ones that came to my light. So we're looking at the moment at published studies. So things like plant-based bioengineered nanoparticles for lung cancer management, which I thought was a particularly interesting one. Antibacterial drones. I have no idea what they are, but they sound cool. And again, bioengineered mRNA from the bioengineering side of things. And from the wearables, I made a list of some of the ones that were published very recently. So an Internet of Things integrated glove, and this is for post-stroke rehabilitation. An orthodontic aligner with force sensing ability, and this was particular interest for me. This is quite a number of other people. I grind my teeth overnight, so I've got like a splint that I wear, and basically this can detect when your teeth are starting to get misaligned. Don't know what it does about them, but I thought that was a really cool thing to be able to do. So lots of home monitoring devices. Wearable devices for self-management in people with cystic fibrosis, and rehabilitation from total knee arthroplasty. And the final one that caught my eye was a new approach to improving global paediatric sepsis care. This was in Bangladesh. We'll see this use of this tech in LMIC countries, I think, is particularly interesting. So that was one of the ones that caught my eye. So that's across both bioengineering and the wearables tech. Just an example of the cool things that sprung to mind.
Amazing. Kate?
Yeah, I mean, there was a lot. I think when we did the initial search, there was over like 5,000 technologies that we had to like screen through. But I think in terms of sort of patterns and trends, there was a lot that was using ChatGPT, that algorithm for different applications, like speeding up making clinician notes, or sort of that personalised medicine where someone could like put their symptoms into a phone and the ChatGPT algorithm would then offer solutions. There's also a lot going on with the medical imaging space, so using Gen AI, where you could take MRI scans, and from that it would construct a 3D model of the part of the body it was scanning. And then at the sort of very early stage, there was lots of signs of like using Gen AI for drug discovery, which was pretty cool.
Wow, I think we could sit and talk about this all day, all the different things that are coming out of these game-changing technologies. So I think we were going to move on to maybe talk about kind of what you'd like to see happen here in the next year. You know, how do you think we can measure these technologies and sort of progress with them?
I think that's a hugely interesting question, and as many of you know, before I was in this role, I was embedded in the field of impact and showing how technologies did get taken up. And I think because we are looking at glimmers, so what we're doing here is horizon scanning, so we're having a look to see what's coming up and really starting to find out where things are on the horizon and what's coming through. So again, crystal ball would be lovely. If I could have one of those for Christmas, that would have been great. So I think it's a case of, because just to sort of give everyone a little bit of context and background, quite often at the Innovation Observatory we do projects for stakeholders, and this is one of the ones that the IO itself is actually leading on. So we get to dictate really what it is that we're looking for, and if I've got 2 minutes after this, I'll talk about the cool methods we're using, because that's kind of cool. So we are presenting this to a stakeholder, the Department of Health and Social Care, and I think what would be nice to see is them perhaps directing funding towards particular ones that we've flagged up, or even accelerating the progress into care, because there's a number of agencies that both they and we work with that is their role, to get these kind of things into care more quickly, and to get some sense of feedback from them as to what this project allowed them to do. Did it allow them to identify technologies that they didn't necessarily know about? Because last summer we ran almost a pilot project for bioengineering where they gave us a list of 50 or so, 15 technologies that they already knew about, and basically asked us to find some more. And we came back with a list of 45 to 50 other technologies that in bioengineering that they didn't know about. So this project hopes to do that. So what we're trying to do is to both find technologies that they don't necessarily know about, and also find out more about those that they do. So some kind of feedback from them as to, okay, so the ones you told us more about, we are now accelerating into practice. And also the ones they didn't know about, could they, like I say, sort of put more funding towards that? And I think we've got to be fairly realistic and practical about what kind of things could change. But I think that's probably realistic. Whether we're putting, you know, these the total knee arthroplasty actually into patients in the next year, I think that might be a bit far-fetched, but at least some kind of glimmer of actually, yes, this is something we're now taking on board and moving forward with. I think that's realistic.
Brilliant, brilliant. Kate, have you got anything to add?
Yeah, so I think one of the things that a lot of the speakers touched on today is one of the big challenges for implementing these new game-changing technologies is going to be the regulatory side of it. And one of the things we've done is really drill down into the kind of different algorithms that are being used in these technologies, because at the moment it's really hard to get regulatory approval because the algorithms are so unknown and unsure, and how can we be certain that they're safe and effective? So by getting a clear sort of idea of what algorithms are being used, hopefully that can help to improve the regulatory side of it.
Yeah, sorting out the underpinning mechanisms where they get taken up into practice is all very well and good saying this is a cool thing, but if there's no way of assessing it works and if it's effective and safe, then I guess it's quite moot. So yeah, if you can sort that out, that'd be great.
Well, before we go into some audience questions, have you got anything else you'd kind of like to put out there, and final thoughts?
I think the only thing I would like to just mention for both bioengineering and wearables is that we've taken a slightly different approach to actually the whole process for this project. So we have about a year to do this. So normally when we find a whole bunch of particularly interesting technologies, and then there's quite a lot of fairly manual sifting that goes on to basically determining what we're interested in and what we're not, and that gives us the inclusion-exclusion criteria. And then quite often that's quite labour-intensive, quite laborious. So for wearables and bioeng, we decided to be a bit lazier and basically make the machine do the work. So we're taking a different approach, and if anybody's interested in the details, very happy to talk to them about that. But basically using clusters, so there's a product called VosViewer that some of you might be aware of, and you feed it some keywords, and then it can cluster various items based on these keywords and also look at the connections between them. And then we're going to look at the clusters and then use an AI piece of software which can then prioritise what there are within each cluster, which is cool. So for example, for bioengineering, one of the clusters we're interested in is therapeutics and drug delivery. So using perhaps nanotechnology to actually get the drugs where they need to be in the patient. So we can cluster those together and then have a look, again, using some keywords, and then prioritise that, and then just look at the top, I don't know, 25% of those. So rather than do that quite manual, fairly laborious work, have a look at it in much more repeatable and slightly less arbitrary way. And that is a process we're developing for the bioengineering arm at the moment. And if that works, which it will, then have a look at that in wearables. So so that's a sort of a slightly different approach we're taking, trialling at the moment, but I think it could be a good way of doing things.
Any final thoughts, Kate?
I think we've done a slightly different method to Pauline, but we hope to try and use this project as well as just identifying technologies, is find a way of classifying them better and classifying that innovation. So yeah, I think that's our final methodology touch.
Brilliant, thank you so much. That was really, really interesting. And I'm sure we've got some questions from our audience, either here in the theatre or online. I'll open it up for questions for our fireside chat, but also our three speakers that we've just heard before. Anyone in the audience? Not yet? Have a think. We did have a question earlier on. Where is that? Did it come direct to you, Sherilyn?
Yeah, it was from Tony Woods. He said, great insights so far. I work for one of the North's health innovation networks funded by NHS and OLS to speed up the spread and adoption of innovation. There seems to be an abundance of public funded bodies supporting innovation. Do the panel feel we are joined up enough and present a cohesive offer to industry and innovators? Did the panel hear that online?
There we go. Welcome back.
Heard it, just thinking about it for a minute before I answer. I mean, maybe I'll start on that. I don't know if Helen and Laurie want to join in, but I think there's certainly a challenge in understanding the sort of rich tapestry of organisations that are in existence across the north, and that's why I sort of highlighted initiatives like that Great North initiative that are sort of aimed at tying things together and representing sort of a single sort of entry point to these things. So probably the answer is no, they're not, but I know there's a lot of sort of efforts to try to be more coherent and more available and more and enable that understanding. But inevitably there's acronyms galore, isn't there, which sort of presents a bit of a challenge to people understanding that, I think.
Yeah, so I will jump in and say I think there's a significant gap around sort of leverage being private and public sector funding together. So having more opportunities to match fund grant opportunities alongside angel investment, I think is quite a big missed opportunity. There's some work going on around that inside the Innovate UK Investor Partnership Programme. However, it tends to be for later stage funding, seed and beyond, rather than pre-seed. So I think more emphasis on early stage funding. I know I would say that, but there is a big gap. We see on average around sort of 8 to 10 applications a week from female founders, and of those about 30% are in medtech and life sciences. So there are lots of businesses out there that need backing, and the available funding is not there yet. But I think it's not just to think that it's just a public sector problem is a mistake. It needs to be a private public partnership approach to filling out some of these gaps.
Laurie?
So obviously I don't work in the private sector, and more have experience with the charitable and sort of public and academic sector. And can definitely see value in greater coordination. You can see as a whole from early 2000s to sort of the present, there has been sort of more coordination. But I suppose one thing is I do think there can be value in diversity of views and opinions. And it's almost like the Christopher Columbus effect. So my understanding is that Christopher Columbus belonged to an Italian city-state, and essentially wanted to go to the Indies, and he sort of essentially went and tried to go to a bunch of kings and princes and things and asked a load of them who will fund him, and eventually one gave him the money and he did it. And it sort of allows a sort of radical idea to be sort of taken forward. Well, so if you take the other end of the world, like in China, we have one emperor, and if the emperor goes, no, we're not having a navy, thank you very much, we'll only have one near the coast, then that's sort of ruled out. So I think there is some value in diversity. I realise the Pacific Ocean is bigger than the Atlantic Ocean, so it's hard to get across. But I do think that sort of metaphor for having sort of diversity of views and perspectives can allow more radical and innovative ideas in there rather than everyone just thinking the same thing.
Brilliant, thank you.
Can I just add, I think that, we've talked about innovation a lot, and we have really skirted around this adoption into the NHS challenge, really. And who did you say? Was it Tony who'd asked the question?
Yeah, Tony Woods.
Oh, Tony, okay, from, I think, North West Coast Health Innovation Network. So, Tony, I'd sort of be interested in your view, really, about how we might sort of, enable that more better. I think Tony's just responded now. So, You know, it is, you know, it's a significant challenge getting, you know, proven technologies or proven in some parts into the NHS, and so maybe some horizon scanning and sort of work from the Innovation Observatory on how that's been done in other places and sort of models to make that work more effectively. It would be, you know, an interesting project to consider.
Yeah, we'll add that one to the list, Teresa. Thanks, Jeff. Have we got any more questions from the audience or online?
There's one online from Nicole Elias, I think it's pronounced that. Why are female-only founder investment figures staying so stubbornly low over such a long time? Helen, do you want to go for that one?
I'm happy to go for that one. So there are a number of systemic and structural issues that are going to take quite a long time to fix, not least of which are the fact that inside UK and global VCs, only 14 or 15% of senior executives are women, which typically means that on investment committees, which is where investment decisions are made, that there often it is unlikely that there will be a woman on the VCIC committee, but even if there is, they may be in the minority. So that means that the sort of half the population's perspective and market potential is being underrepresented in those environments. So that's why things like the Invest in Women Code, which I mentioned at the beginning of my talk, are so important, because they're encouraging transparency and focus inside those VC organisations to build diversity of pipeline, which is another structural issue, you know, making sure that you see a fair representation of female founded companies in your pipeline, because you're going to have a continuous influx of all male teams coming at you. As I know from having run a mixed gender angel network, you have to be super intentional to make sure you've got diversity of pipeline. Back to Laurie's point, all kinds of diversity need to be represented in the pipeline. So that those are some of the key issues. And then you've got the fact that only 25% of the UK's entrepreneurs are women. So, you know, the investable pool is smaller to start with. So there's also some work needed to be done to encourage more women to step forward and run their own businesses. I think change is coming, and there's lots more focus on this, but the acceleration of change still needs to speed up considerably. A lot of targets have been set for 2030, which at the current trajectory are not going to be achieved unless we can really make some big inroads into diversity in VCs in particular.
Thanks, Helen. Any other questions? Oh, Teresa.
Just bring the mic. Hello, I've got one relating to the fireside chat, and I'm honing in on Kate around the nomenclature. So you mentioned the importance of developing nomenclature to define these new technologies. Can you tell me a little bit about your approach to that and who you're in conversation with? Because if you're saying it's called something, what are they calling it?
Yeah, so at the moment there's quite a few different agencies that have different like nomenclatures or classification systems for medical devices. And one of the big challenges is that they're not really lined up. There's different nomenclatures or classification systems that are used at different stages, like regulatory or like at the patent stage. So we're interested in finding a classification system that we can use as horizon scanners that's going to be really effective for identifying how we classify early innovative medical technologies. So we've been having conversations with the GMDN, the Global Medical Device Nomenclature System, and working with them to see how we can sort of adapt their classification tool and use that to provide more insights when we're doing horizon scans. So we say we've got a technology and we can very easily classify it as this is the innovation about it and this is the term and the code number associated with that.
Can I add something to that? Sorry, it wasn't me, but I mean, you'll have seen through all of our presentations that the nomenclature we use to describe even the sector varies from source to source. So you know, how someone describes pharma, others might use biopharma. You know, sometimes biotech is a subgroup of that, etc. So it's really tough to, you know, to sort of cross-refer different sources of information and data. So I sort of really feel your pain. So anything that can be done to sort of standardise some of that and classify that would be really useful, I think, in allowing us to really pull out the, you know, the real messages in the data and understand the real challenges ahead.
And just to add to that, I think it's the nomenclature idea isn't only important in the overview when you're writing up reports and presenting the findings, but then when you drill down to, so we've got a couple of information specialists working on our project, and their bread and butter is search terms. And so when we're looking for these signals, when we're looking for these technologies that we want to talk about, one of the key things is working out those criteria and actually working out the search terms. And when I asked my long-suffering information specialists, okay, so I want you to go and have a look at biotechnology. It's like, well, is it biotechnology? Is it bioengineering? And sort of really thrashing out those key terms. So not only is it important for talking between bodies, making sure you're on the right lines, but also all the way down to actually looking for these things. It's really, really key to make sure that we're talking about it. So thank you, that's a really valid point.
Great, one more question, I think, from Andrew.
Thank you. So my question is to Pauline and Kate as well. So are there any ethical consideration that needs to be addressed with the developments and implementation of these game-changing technologies?
Very valid question. So are there any ethical considerations? There are, and so for the studies we're looking at, they are published studies. So I would imagine that being a published study, they would have gone through the ethical considerations before being published. Otherwise, there's something gone very wrong in the publication process. As and when we pull out the individual technologies, that is going to be one of the things we're looking at, especially for the wearables, which obviously do have the are then tested out on humans. So as we look through them, that is one of the things we'll be looking at. I guess it's less of a problem for AI, the ethical considerations, but.
Yeah, I think the ethical considerations are different with AI. I think one of the big ones as well is making sure that the training set and the training data is that representative of the population it's going to be used on, or is the training data biased towards a certain population and therefore you can't apply it? Is it going to give the same results to everyone? So yeah, the challenges are different, but they're still there.
Yeah, so it's more of an accuracy question, I guess, than ethical. Yeah. I guess the only ethical thing would be like if you're trying to use data that was trained from a different data set and then try to apply it to a new one, would that be ethical, I guess? But yeah, does that answer your question, Andrew? Is that?
Thank you.
Brilliant. I'm just going to read out the comment from Laurie, thank you. So, it's not on the screen. He said, I wonder what large language models mean for, don't know that word. Do you want to say it, Laurie?
Yeah, it's more of amusing. I suppose I was wondering what we're sort of chatting about nomenclature, and I don't have the expertise, obviously, the people on the panel. But I was wondering what large language models mean for nomenclature, because my understanding is they can handle greater ambiguity, like they can handle natural language better than sort of previous methods. And I wondered, does that change anything, both allowing us to sort of not classify things in the same rigid buckets as before and have more fluid buckets, but also can create greater confusion because those models can hallucinate and get things wrong? I don't really know the answer, but I think it's an interesting effect that technology has on the mapping methodology. That's my guess.
Thank you. Right, I think we literally have finished at perfect time in there, so it's 11:30, and that's us. So thank you very much to our three speakers and our two fireside chat people, members of staff. You've been brilliant. And Stu, can I just get the slides on, because I think I had a couple of last things just to say. Thank you for attending. It's been brilliant. It's been really nice to see people here in person, and we've had about 35 people online, so that's brilliant. As I mentioned, we do have the expert and virtual residence part of this, which is happening now. We're all fully booked for today, but in future months we have that resource available to you. I will follow it up with an email after to give you the options for next month. And please follow us on LinkedIn, Twitter, Facebook, Eventbrite, and have a look at our website. We have all of our news, events, resources there for you to take advantage of.
Our brand new website.
Our brand new website, and also if you go right to the bottom of every page, you can sign up to our new Innovation Observatory e-newsletter, which will be going out hopefully next week once I've had it signed off. So that would be great. That will be sharing everything that's basically happening in the next sort of year, basically. So thank you very much, and we'll see you next time.
Thanks.